What is the financial cost of lung cancer wedge resection? Imagine needing surgery to remove a small part of your lung because of cancer. The procedure is called a wedge resection, and it's often used for early-stage lung tumors. The cost of this surgery can vary quite a bit depending on where you are, the hospital, and the surgical method used. On average, the hospital charges for a wedge resection tend to be between $31,000 and over $50,000. One study reported that the typical cost for a wedge resection in early lung cancer was about $51,487. Another analysis focusing on non-small cell lung cancer found that hospital costs alone averaged around $31,900. These costs tend to go up if the cancer is more advanced or if additional treatments are needed afterward. Wedge resection is a lung-saving surgery that removes a small wedge-shaped piece of lung tissue containing the tumor along with some healthy tissue around it. It's often chosen for smaller tumors or patients who might not tolerate more extensive surgery like a lobectomy, which removes an entire lobe of the lung. While wedge resection can be less invasive, it may sometimes be slightly more costly and carry a higher chance of needing further treatment, depending on the case. The total cost includes several parts. First, there are the expenses for the surgery itself, including surgeon fees, anesthesia, and surgical instruments. If minimally invasive techniques like video-assisted thoracoscopic surgery or robotic surgery are used, the costs can change. Robotic surgeries tend to be more expensive upfront, sometimes around $15,000 to $22,500, but they might help patients recover faster and stay in the hospital for fewer days. Hospital stay costs are also significant. Patients typically stay in the hospital for about 6 days after lung surgery, and intensive care unit fees can add to the total. The longer the stay or the more intensive the care needed, the higher the costs. After surgery, there are follow-up expenses like outpatient visits, imaging scans, chest tube management, and rehabilitation, which can add up over time. Insurance coverage plays a big role in what patients actually pay out of pocket. Costs can differ greatly depending on your insurance plan, the country you're in, and regional healthcare prices. From a lung health perspective, wedge resection can help preserve more lung function, which is important for quality of life. But it's also important to consider that other treatments like stereotactic body radiation therapy might be less costly and just as effective for some patients. In summary, the financial cost of a lung cancer wedge resection is generally in the range of tens of thousands of dollars. It depends on the surgical approach, hospital resources, and individual patient factors. Patients should discuss with their healthcare team to understand the full financial picture and explore options that balance treatment effectiveness with affordability. Always remember to seek personalized advice from medical professionals to make the best decision for your health and financial situation.